Hello everyone, nice to meet you here. During today's lecture, I will briefly explain about a common mental health problem, which is called the bipolar disorder. Bipolar disorder is previously known as manic depression. This is a mental health condition which involves cycles of extreme low and high mood. A patient who suffers from bipolar disorder normally have two extreme feelings. Sometimes the patient could feel really high, feel very happy, and extremely energetic. So this is called manic. And sometimes the patient could feel very low with depressive symptoms. So the patient could have really bad mood. So the two mood actually comes and go, and they fluctuate quite often. So the patient um, have this cycle of these manic and depressive symptoms all the time. And this cycle could be different for everyone. Now, for some people, these episodes can last for 3 to 6 months and occur every few years. Now, others might experience shorter but more frequent episodes over the course of 1 year. Now, the treatment with medication could stop the symptoms. However, this condition is very difficult to be fully cured. So normally the patients suffer this condition for a long time, even lifelong. Now, the exact cause of the bipolar disorder is unknown. There are a lot of contributing factors, which could include the unbalanced brain chemicals, the genetic factors, environmental factors, physical illness, or the personal stress. The research indicates that around 80% of the causes are genetic. So we can see that family history and genes play really significant role in developing this bipolar disorder. So most people who suffer from bipolar disorder now, they carry this vulnerable gene. They carry that gene, which makes them more vulnerable to develop this condition. And they could have some family members who suffer from the same problem. Now, the symptoms of bipolar disorder generally start in early adulthood, normally around 20 years of age. For most people, the disorder is a lifelong diagnosis. However, if we provide patients with appropriate treatments and support, now that most patients can still maintain a good quality of life. So we know that even it is very hard to be treated, still if we provide enough support, now the patient can still lead a normal life like normal people. It is estimated that approximately 1.3% of Australians live with a form of bipolar disorder. 1 in 50 adult Australians experience this condition each year. So it is actually quite popular. Now we're going to talk about the types of the bipolar disorders. There are a number of different types of this condition. The first type is called the bipolar 1 disorder. Now, people with bipolar 1 disorder typically experience one or more manic episodes, extreme high mood, lasting at least 1 week, as well as depressive episodes and psychotic episodes. So the patient have both high mood, very high mood, and very low mood, but they high mood actually lasts a bit longer time, lasts at least 1 week. So this is called a bipolar 1 disorder. Now, secondly, we have bipolar 2 disorder. So patients with bipolar 2 typically experience both hypomanic and depressive episodes. But what is hypomanic? So hypomanic means the symptoms is less intense than the manic. So hypomanic is like the symptoms, the mood is less strong than the less intense than the manic. So patient experience also high mood, but is less serious, less intense. So for patients with bipolar 2 disorder, the hypomania lasts normally a few hours or days. So it's like lasts for a short time rather than weeks. So although bipolar 2 disorder has less severe symptoms than bipolar 1, it could be chronic as well. The depressive symptoms for bipolar 2 disorder are often more frequent and longer lasting. So we know that bipolar 1, now patients with bipolar 1 have longer period of mania, have longer period of high mood, which is called mania. But patients with bipolar 2 disorder have normally longer period of depression, longer period of low mood, but shorter period of mania. Now, the third type is called a cyclosemic disorder. Cyclosemic disorder is characterized by persistent and unpredictable changes in mood. So the highs and lows are much less extreme than bipolar 1 or 2, and the episodes are shorter as well. So it's less frequent episode and less severe symptoms for this type. We also have mixed episodes. So some people experience mixed episodes, means that they can feel some of the signs and symptoms of both mania and depression or hypomania. So all the symptoms can mix together. Now let's have a look. Let's have a look in detail about these symptoms. Now we know that there are two feelings. One is mania, one is depression for this bipolar disorder. Now for mania, so common symptoms of mania include feeling extremely euphoric, very high, which is very high or energetic. Patient could feel restless, very agitated, very irritable, have easily to lose temper, have trouble with sleeping, talking quickly and very fast. Also, patient could have reckless behavior such as overspending money, participate in some like activities, a lot of activities, and become very restless. So this is like the symptoms for mania. Now for depression, when patients feel depressive, now the symptoms of depression could include withdrawn from people and activities, being isolated, have the feeling of sadness and hopelessness, lack of appetite, lose weight, feeling very anxious or guilty. A patient could also have difficulty in doing things or paying attention, or even patient could suffer from the suicidal thoughts. So patient could hold that suicidal thoughts, and that will be very risky. So that's the detailed symptoms. Now, apart from feeling depressive or mania. Now, patients with bipolar disorder could also have symptoms of psychosis, including delusions or hallucinations. Now, we know that when we talk about the schizophrenia in the last lecture, we know that hallucination is like hear or see something which do not exist. And delusion means that patient could hold a false belief and believe something which is not real. So for people who suffer from bipolar disorder now, delusions and hallucinations are also possible to show. So they are also possible for patients who have bipolar disorder. Now let's talk about the causes of this condition. Now the exact cause of bipolar disorder is unknown. But there are some contributing factors include genetics, brain chemicals, environmental factors, physical illness, and stress. Now, again, we mentioned before, so 80% of the bipolar disorder now is caused by genetic factor, unfortunately. So people who have a strong genetic predisposition to bipolar disorder, now they are more vulnerable to develop this condition. some patients they carry that special genes, and then they're more vulnerable. And also, if the patient have a family member or more than one family member who suffer from the same condition, then they are more likely to develop this problem as well. So now there are some other triggers. For example, now if the patient have a like traumatic past life experience, such as the abuse or trauma happened in the past, now the patient could also have like the risk of developing this condition. So stressors, so certain type of life stresses could contribute to this problem as well. But we know that genetic factor plays the most important role. Another reason is that this condition might be linked to the brain chemicals according to a lot of research. So the brain chemicals is also called the neurotransmitters. Now, two types of neurotransmitters, including serotonin and norepinephrine and serotonin. Now, these two neurotransmitters play important role in maintaining a person's mood, maintaining a stable mood, stable emotional status. So patients who suffer from bipolar disorder could have unbalanced amount of this serotonin or the norepinephrine. Now, these two neurotransmitters could be released abnormally inside the brain. Now, because we know that the neurotransmitters, especially serotonin and norepinephrine, now these two types of neurotransmitters, now they help to regulate mood. So the patient, now some patients they could carry a gene, now make them have like make their brain actually release less amount of these neurotransmitters and then trigger this condition. Well, the onset of the bipolar disorder may be linked to stressful life events. It is unlikely that stress causes bipolar disorder. So, stress by itself could not just lead to bipolar disorder. We know that genes, the genetic factor, still plays a dominant role. So, people who live with bipolar disorder often find that managing and reducing stress in their lives helps to reduce their chance of triggering a relapse. So, but again, people who have bipolar disorder now, they are more vulnerable. So we need to always try to help them to manage their own stress and reduce the stress in their lives. Yeah. Now let's start to talk about the treatment for this condition. Bipolar disorder requires a long-term treatment and management. Because it's a long chronic ongoing condition and even lasts for lifelong, so we need to provide patients with ongoing treatment. Now, these treatments could include the psychological therapies, education, community support programs, self-help groups, emotional support, or at the last choice, we can give patients mood stabilizing medications, antidepressant medications, or antipsychotic medications. So the medication should be taken as a last option, as they all have like the side effects. Now, let's have a brief talk about the different kind of therapies. Now, a very popular therapy is called the cognitive behavioral therapy, CBT. So CBT helps the patient with bipolar disorder to change the harmful or negative thought patterns into the positive thought. So we can, the therapists, normally the psychologists, can help to organize some programs and try to convert and have a talk with patient and try to convert their negative thought into the positive thought. So this is called the cognitive behavioral therapy. For example, patient always hold some belief that he or she cannot do something and he feels like very down because he cannot cope, and there are a lot of negative things happen in the life or something. Everything is very negative. So the therapist could help them to convert their negative thinking into the positive, could let the patient to think about what are some like positives sides in their life and help them to gain more confidence. Now, the next therapy is called the family-focused therapy. So family-focused therapy includes the family members. So the therapists could help the family members to involve into patients' care. So it helps to enhance family coping strategies, such as recognizing new episodes early and helping their loved ones. So if the family members can be involved into patients' treatment, and they could share their feelings with the family members, and the family members can also be educated about this condition, so they can show more understanding and more empathy for their for the patients. And this therapy also improves communication and problem solving. And also we can provide interpersonal and social therapy. So the therapist can organize different kind of social activities to help people with bipolar disorder to improve their interpersonal relationship with others and manage their daily routines. Regular daily routines and sleep schedules might help to protect against the manic episodes. We can help the patient to set up the sleeping schedule, to set up the daily routines, organize some tasks for them to complete, so they won't get distracted easily. Also, we can do the psychoeducation. So psychoeducation means that we can teach the patients with bipolar disorder about the illness and the treatments. We give them education. We guide the patients how to, so let the patient to help themselves to understand their own condition. So this treatment helps people to recognize signs and symptoms so they can seek treatment in the early stage. So the education is usually done in a group. So we can organize group educational program, and it also could be helpful for the family members and the caregivers. So again, if the family members, patients can all receive some sort of training about these conditions, so they can have more understanding and become their own therapist. So normally a licensed psychologist, social worker, or counselor, now these people they provide the therapies, different kind of therapies to help patients to recover. Now again, there is another kind of there's another type of therapy now is very commonly used. Now this is called the electroconvulsive therapy. Short term is ECT. So what is electroconvulsive therapy? Now this therapy ECT is normally used when the other type of therapies all fail. ECT is a safe and effective treatment, and it is most commonly used to treat severe depression. So what is ECT? Now, ECT can help patient to balance the mood. So during the ECT procedure, now the therapist will apply like some electrodes on the patient's head, and these electrodes could deliver a small amount of the electrical current into the brain, and help the brain to stimulate the electrical activities inside the brain. So help to stimulate the connections between these brain cells, and increase the to try to balance the amount of the neurotransmitters inside the brain, to make the release of the neurotransmitters become more balanced. So the delivering, so again, ECT involves the delivering of the electrical impulse into the brain to help to balance the mood. This electrical impulse could cause a seizure that affects the entire brain. So if the brain activity, so because this procedure could change the brain activities, it could help the patient to maintain a better mood, better appetite, and sleeping. So the ECT causes chemical changes in the brain that relieve both depression or mania and help the patient to properly maintain a mood, a balanced mood. And this ECT treatment works very well. More than 70% of the depressed people who receive it respond favorably, making it the most effective treatment for especially for severe depression. So again, ECT is called the electroconvulsive therapy, and it is mainly used for the severe depressive symptoms. It can be also used for mania as well. So it helps the brain to maintain a normal to restore the normal brain activities. Yeah. So that's all about today. So I hope from this lecture you could gain a little bit more understanding about the bipolar disorder. Thank you very much. Thank you.